Hello, this is Dr. Jazayeri. Everybody knows me as Dr. J. I wanted to talk to you about weight loss. I occasionally see some patients that obviously if they're morbidly obese and they need to lose a lot of weight, I refer them to other people for potential bariatric surgery. But let's say a patient wants to lose 15, 20 pounds, 25 pounds, somewhere in there. They always ask me for advice. The first question I always ask is, do you feel cold and tired all the time? I've had, especially in women, I've had some patients who did thyroid studies and their thyroid was hypoactive, so it wasn't working very well. And the thyroid kind of sets the thermostat for the body, so it adjusts the metabolic rate. And so if the patient's thyroid is not working, essentially they have to starve themselves to even try to lose any weight. So, and also hypothyroidism can potentially, become very dangerous. So that needs to be addressed and corrected. In most cases, however, most people, they don't have these issues. And honestly, it's very simple. If you take more calories than you burn every day, that extra calorie will become stored as fat in your body. And that was there's a mechanism, an evolutionary mechanism, because when we started a million years ago, we had to go find food, and sometimes there were no food for days. And so if our body had learned to store things because of that situation, well, now we don't have that, at least in this country. And so that evolutionary mechanism is actually hurting us. So to gain a pound of fat, so each gram of fat, let me go back. Each gram of fat is about 9 calories. And a pound has 453.6 grams in a pound. So essentially it comes to about 3,500 calories to gain a pound of weight. And the other side is you need to lose 3,500 calories to lose a pound of weight. So the good thing is it's really hard to gain a pound a day. You have to eat 3,500 calories more than you burnt. And the average person probably loses about 2,000 or needs about 2,000 calories a day. So it's really hard to eat 5,500 calories a day. So most people just gain weight slowly, right? And you want to lose the weight slowly too. It's really hard to lose a pound a day, unless you're just not doing anything and working out at the same time. And you're probably going to pass out. So patience, these diets are designed for you to lose weight, but it's just a temporary solution. So I don't recommend patients going on these 500 calorie restrictive diets and this and that, because you need to change your lifestyle. If you go on a diet, you lose the weight, and you go back to eating, well, you're back to square one. So the way to do it is to, if you need 2,000 calories a day, take 1,700 calories a day. Just a little bit. That extra bite of whatever, or that extra, dessert or whatever you're doing, just don't eat it. And you're slowly going to lose the weight. I've had some patients that had really good result with Weight Watchers. Again, I don't have any financial interest in them, but it makes sense because Weight Watchers gives you points for each meal and how much you're eating. So essentially, you're doing a very strict calorie count that's guided for you. Obviously, you can do this alone, but most people don't have the time or the discipline to do that. So that's one way of doing it. What about exercise? Everybody asks me. You should definitely exercise. Exercise, however, is not a weight loss. Is not a good weight loss strategy, because even if you're working out very strenuously for an hour, a strenuous exercise, in most people you're going to lose 500 or 600 calories. And you have a little slice of cheesecake, you're there, or you can really, anything you eat is going to have at least, that much calories in most cases. So but you should exercise. Exercise is good for your health. Is, you know, builds up your cardiac muscle. You know, if you're doing strenuous exercise, you know, that's so you're working. You don't have to work super hard, but if it has enough intensity, the real good thing with exercise is your brain will, you know, release endorphins. And we talk about that, you know, exercise high, or runner's high. And, you know, I always say, you know, I've said this many times, why pay a premium for synthetic heroin where your body can, produce, you know, natural heroin for free and free of side effects. I mean, endorphins are essentially like heroin. They make you feel good. So, you know, it is important to put exercise in your routine. But bottom line is, 99% of the time it's a calorie thing. And people just don't realize how many calories are in foods. You know, the perfect example, you know, you've heard this many times, the person who eats salad all the time and it says, well, I can't lose weight, and they're pouring, you know, all these fatty salad dressings on their salad, and it's like you know, this big lot of salad, which is good, a lot of fiber, but they're covering it with, you know, 1,000 calories each time they're doing that. So, you know, all these coffees, you know, coffees that you eat from Starbucks, a lot of them can have 400 or 500 calories. Mixed drinks, you know, about the same. You know, so keep that in mind. Just because something is small doesn't mean it doesn't have a lot of calories. The best thing is obviously a lot of fruits and vegetables, to bake your food rather than frying it. If you go out and eat a lot, they just have more calories. I mean, you know, you go to Cheesecake Factory and P.F. Chang's, look at their menu. Almost everything is 1,000 to 1,500 calories. So if you go there, just eat half of it and eat the other half tomorrow. You know, that's really the simplest way, or divide it by 3, you know, however you want to do it. But a lot of foods outside, they taste good, and because they have a lot of fat and butter and this and that. So it's hard, but at the same time it's simple to lose weight, because it's very simple how you can lose weight. It's not a crazy formula. Well, I hope this helped. If you have any, if you want to look at some more information, look at our before and after photos, please visit our website, www.drjaz.com, drjaz.com. Thank you.